Welcome to the vibrant world of nursing, a journey filled with challenges, learning, and immeasurable rewards. Now, can we keep it 100 in this video? Yeah, let's do that. I'm gonna keep it 100 with you guys, and I'm gonna share with you guys some things that I wish that I knew as a new graduate nurse. So if you're ready, if you're interested in nursing, or if you are a graduate nurse, or you're even considering nursing, this video is for you. Or if you know somebody who's any of the following, send this to them because these tips, y'all, you ain't gonna get this on the NCLEX. My first tip is to ask all the questions. Yes, embrace curiosity. Do not hesitate to ask a question, ask away. I don't care what anyone says, asking questions is a sign of a diligent and engaged nurse who's committed to both learning and providing the best patient care. Don't be scared, don't be nervous, don't be prideful. Listen, I know what it's like to be the new nurse and you feel like you're walking on eggshells and you don't want to ask everybody all these questions because you don't feel like you're competent. Listen, ask away. These are people's lives at risk. Get out your head and realize that literally everybody asks questions, even the seasoned nurses. I've been a nurse for 6 years and I have nurses who have worked longer than me who come to me asking me for questions. Why? Because nobody's perfect and nobody knows it all. And sometimes you might have a case or have a patient that has something that you haven't done in a long time. It's okay to ask. Listen, as the healthcare system is constantly evolving, so is the information that we gather from our patients. Do not let your pride be the downfall of someone's life. If you have a question, ask it. Do not assume. Tip number 2, write everything down. Listen, when I first started, I thought I was the super nurse who could remember everything in her head. Y'all, when I tell you a couple weeks in, when I was still with my preceptor, people would make rounds and find medications hanging. I'm like, oh my gosh, I forgot to do that. There was a doctor who once came at me. He was yelling at me because I forgot to do a Vancotrol. And I was like, oh my gosh, that was due? And he was like, the order is in, da, 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 da. Like, he was going crazy. I literally would have saved myself so much headaches if I just chose to write everything down. So now what I do when I come in, my little routine is to make the assignment. I make rounds on all my patients, and then once I get a report and all that, then I write down my patients, I write down the medications that are due, and then underneath all that, I write a to-do list with each patient's room number, and then I write little check boxes for things that I need to get done throughout the shift. Because sometimes you think you can remember everything, but y'all, at least the unit I'm in, things are always popping up. Like, it's a medical acute setting. Literally anything could happen that could literally just take your mind elsewhere. A patient could code, anything could happen. So write everything down. You're not gonna remember everything, especially if it's important. Make sure that you write things down. It is so crucial for us as nurses to learn how to manage the demands of this job with both efficiency and precision. Some of the things that I write down include drawing a lab for a patient, maybe rechecking a blood pressure or a blood sugar if it was too high or too low, or even simply just checking a patient's drainness. Like, I don't care how little it may seem, I'm writing it down to ensure that I get it done before the shift ends. Time management, again, is so key as a nurse, so please write things down. I cannot stress this point enough. Next is embracing the M word. Yes, the thing that we do not want to do, especially as a new nurse, but it is bound to happen: mistakes. Mistakes are inevitable. Like, it's gonna happen. You're gonna make a mistake, but it's okay because it's a part of the learning process. And here's the thing, mistakes can either make you or break you. You can make a mistake that's so huge that you will say to yourself, you know what, because of this, I know that I'm going to be more diligent in this area and not try to rush through things or not take this for granted. And the one thing that you never want to do, even though I know you might be tempted to, is keep a mistake to yourself. Do not keep mistakes to yourself. Being open about errors is key to personal growth, patient safety, and just maintaining trust within your team. And think about how your mistake could affect the patient. Let's say you gave the wrong dose of medication. You gave a higher dosage that was ordered. Now this patient is getting all confused. Now they're probably crashing and the doctor's wondering, hey, what's going on? Are you gonna keep that to yourself? Or can you let us know so that we can possibly reverse this with something else now that we know what's going on and why? You're gonna make a mistake at some point, either as a new grad or just somewhere down the line, and that's okay. But it's how you respond to and grow from these mistakes that's honestly gonna define your nursing journey down the road. Next, nursing is 24 hours. And I think this one took me a while to really grasp the concept of it. I'm the type of nurse, like I said, I write my to-do list. I like to get everything done on my shift, but y'all, there are gonna be days when you're gonna be so understaffed. You're gonna feel like you're the respiratory therapist, you're the clerk, you're this, you're the attendant, you're that. There are gonna be some days where you are just not going to get everything done. You're not. And then what are you gonna do? I'll tell you what you're gonna do. You're gonna hand it over to the next shift. But what we're not going to do is be willfully lazy because we don't feel like doing something and hand it over to the next shift. No, we're gonna ensure that we do the best that we can and the most amount of things that we can. And if we aren't able to, not because we're lazy, but because we physically aren't able to, that's when we endorse it over to the next shift. Okay, you understand what I'm going with? You might not have been able to give a medication or do a dressing change or a bladder scan, and that's okay. Honestly, as long as it's something that is not crucial or detriment to the patient's care, hand it over. Do not burn yourself out trying to do everything. Please, you are not super nurse. Hand it over with the help of your colleagues. It can get done. Understand and respect the around the clock commitment that nursing demands. And honestly, I believe that you're going to be a better nurse for handing over that which you weren't able to finish on your shift instead of constantly stressing yourself at the end of every shift like, oh my gosh, I have to get this done, I gotta get this done. No, don't do that. If you aren't able to do it, just hand it over. Next tip, baby, always cover yourself. Documentation is key. Rigorous documentation has gotten me and so many nurses out of so many sticky situations. It's literally like non-negotiable, and it's essential for continuity of care, legal protection, effective communication amongst healthcare workers. Like, your documentation will always cover you. If a patient is telling you something that's really concerning to them and they have questions, you relay that to the doctor and make sure you document what was said about the patient, which doctor, make sure you get their name and wrote it down in the note, MD notified and made aware. If a patient is refusing medication, you document that. If a patient is making inappropriate remarks, you document that. If a patient's baseline even seems a bit off, document that. Like, do not jeopardize your license that you worked so hard for because you've got to cover your butt. Document, document, document. This next tip, please always remember to round before taking report. The amount of times I see so many nurses clock in, put their belongings away, get their assignment, and go straight to the computer and not even look at their patients once, that is horrible care. One thing about me, I don't care how late I come in, and I don't come in late because I'm a punctual nurse. I come in literally 30 minutes before my shift starts, but I digress. But if I were to be late, like, it doesn't matter. I'm always gonna round on my patients before I take report, because there have been so many instances where a person's report that they received during handoff didn't match up to what was presented with the actual patient. I've literally heard stories about people getting report on patients who were unalived. And you would have noticed the patient wasn't breathing if you did rounds. So it says a lot about you as well. You come in, you see medications hanging, that nurse already left, but she told you she gave it, but it's hanging here and this and no. Always round. And when you do get report, make sure that you get it at the bedside so that you can see and hear that what you are receiving matches up to that which you see. Next, you need to know that nursing is full of highs and lows. I wish that I could say every shift I felt like I was on cloud 9. I had the perfect assignment. I had easy patients. I had the best of family members. I wish I could tell you that, but I would be doing you a great disservice because I would be lying. You need to mentally prepare yourself for the roller coaster of emotions and understand that there will be tough days. Honey, there will be days where you question, why did I even become a nurse? Why did I get involved in this crazy profession? There will be days where you question your competency, your judgment. You're gonna have some pretty low days, I'm not gonna lie. But those lousy days aren't worthy to be even compared to the fulfilling days that you're also going to experience in the job. Those moments where you have those interactions with patients where they're just so thankful that you helped them overcome something or helped just in the duration of their care. You have family. I had a family member last night who literally hugged me because she was like, thank you so much for taking so much care of my mom. Like, you are the best nurse here. We love you. And I just felt so good inside. Remember your why and allow those fulfilling days to reinforce your passion for nursing. Next, I want you to know it's okay. You are going to master your skills. So I remember in my senior year of college, I went to Honduras for a mission trip. Our class went to go help out in a nearby village in Honduras, and it was a lot of fun. I enjoyed it. And while we were there, we were at the clinic, and it was me and my other friend, and one of the nurses there volunteered for us to do an IV. Now the IV the IV was something that I was so afraid of. Like, I did it in skills lab, and of course, skills lab, it's a dummy, anyone can do that. But doing it on an actual person, I was a little hesitant. So my friend, she tried initially to do it, and she didn't even touch her. Like, she was just so hesitant. She didn't even grab her arm or nothing. And I said, you know what? I can do it. Me and my eager self. I was like, you know what? I can do it. I got this. Y'all, I took her arm. I put the needle in. It infiltrated. No backflow, nothing. She pulled back her hand and she was like, ow. And I was like, oh my God, I'm so sorry. Like, I literally thought I had it in the bag. I didn't. From that moment on, doing IVs was the one skill that I felt the most incompetent in. And guess who's mastered it now? Me. Honey, guess who people come to ask to place an IV if they can't do it? Me. Now, do I get every IV? No. But I'm pretty darn good at it anyway. Some patients are just hard sticks. Some people have really bad veins. Some people have really bad rolling veins. Like, I'm not gonna get everything. I'm not gonna be perfect. I'm not perfect, but I'm pretty damn good at what I did. I practiced. I didn't allow that one moment to just keep me down. And I'm so glad to see how far I came. Like, if I could go back and tell my new grad self, don't worry, you're gonna get it one day. They're gonna be asking you to put them lines in. They're gonna call you the IV queen, boo. I wouldn't have believed it. But look at where I am now. So please trust me when I say that with time and experience, you will master that skill. Whatever the skill you might feel the least or the most incompetent in, rather, you will master it one day. You will. Each day is a step closer to becoming more proficient and confident in your practice. This next tip is to never stop assessing. A great nurse is constantly assessing her patient. And assessing doesn't always mean listening to lung sounds or feeling the abdomen or palpating and stuff like that. No, assessment literally begins once you receive handoff and you go around on your patients. What's this person's baseline initially when I receive them? Can they talk? Can they walk? What's their mood like? Is it a bit flat effect? Assess their labs, their vitals. Does anything seem out of the ordinary? You know, this person's sugar is usually within a normal range, but I see now it's spiked up. That's odd. Or this patient's sugar is usually very high, but now it's really low all of a sudden. I wonder what's going on. Always be in a state of assessing your patient. And honestly, always listen to your patient, because sometimes simple conversation and even patient history, those will give you clues that won't always appear in the vital signs. Consistent and thorough patient assessments are crucial, okay? This is what forms the foundation of your care plan, and it's integral to the patient outcome. Next step, listen to your gut. Yes, your gut. You have a gut. You might be new, but you have a gut. You got your degree, you passed the NCLEX, you have a gut, and you need to listen to it. Now that gut, it's gonna take some time to develop, but if you have a little off feeling about something, investigate why. There are so many instances where not just me, but other nurses have had patients where something just seemed a bit off about them, and next thing you know, they're coding. They're a rapid response. They end up in the ICU. Like, trust your gut. If you see something off with the patient, tell the doctor. Let them do a physical assessment. Let them gather some more information. Maybe something really could be going on. Like the vitals and everything, yes, everything could be stable, but maybe there's something deeper to this. I literally remember a time where I had a patient, me and the patient were talking after I gave the patient their medications, and then I left. Pretty soon, not too long after, maybe like 30 minutes after, the nursing attendant who was trying to do vitals on the patient calls me in the room saying the patient is sleeping and that she's gonna skip over the patient because they're not letting her take the vital signs. She's asleep. So I'm like, no, let me see. I'll wake her up. She needs to get her vitals done. So I'm waking her up, and then while she's waking up, mind you, before she was A&O times 3, ambulatory, all that. She was fine. She's trying to wake up, and she's like saying stuff that doesn't make sense. And I'm like, this is weird. What's going on? So I go and I tell the doctor to come in there. The doctor comes in, ends up calling a rapid response on the patient because of her change in her mental status. She's asking me, was she like this before? I'm like, no, we were just talking. She was fine. And now she's speaking nonsense. Turns out that patient was on cloud 9, okay? Yes, if you're able to pick up what I'm putting down, the patient was on cloud 9, and we had to give her something to help wake her up properly, and let's just say things were confiscated, and that's not gonna happen again. But honestly, even to this day, I think, what if I just let the nursing attendant not take the vitals because she was sleeping? Or what if I ignored her being loopy, thinking, oh, she's just tired. Everybody says stupid stuff when they're tired. Like, no. I knew the baseline of my patient. I knew something was off. And because of that, we were able to save a life, because anything could have happened to this patient. So please, always trust your gut feeling. It won't lie to you. And lastly, because I don't want to make this video too long, always make time for yourself. You need to have an outlet in this career, and you will be a better nurse for taking care of your mental health, your physical health, and just your overall well-being. Nurse burnout is real for new nurses, and one of the best ways to avoid that is taking time for yourself. Go for a walk, go shopping, go hang out with friends, get a pedicure. Do something that helps you to relax and just disconnect from the job, because honey, if you can take care of patients for 12 hours, you can take care of yourself. I think I experienced nurse burnout probably my 5th to 6th year last year to this year. During COVID, I wouldn't say I experienced it, but these last year, I think because after COVID, the staffing just went so bad. And a lot of us have had to pick up on a lot of stuff on ourselves because we don't have as much help. It's been a lot. It's been draining. It's just been mentally annoying. And honestly, how I conquer that now is just when I go home, I'm chilling. I'm relaxing. If I want to do overtime, I'm gonna, but I'm not gonna pressure myself into doing that. No, I'm relaxing. When I come home, this is my sanctuary. I'm going to do what I can to just prepare myself mentally for the shift coming up, yes, but while I'm home now, I'm just relaxing. I'm doing what I need to do, honey. So yes, guys, those are all the tips that I have for you today. I really hope that they were helpful. These are some things that I wish that I was told when I first started out. And I want you to remember this. Once your 12-hour shift is over, just remember, there is no amount of fear, hate, or disrespect from patients that can take away the honor it is to be a nurse. As much as I have crazy days and I can complain sometimes, I love what I do. I have a passion for what I do, and I'm so thankful that I was able to pass my NCLEX and do this for 6 years now. I wouldn't trade it for the world, and honestly, what I love about nursing, there's so many different aspects to it. If you don't want to do bedside, you can go outpatient. You can do community nursing. Like, you can do nursing informatics. There's so many different directions that you can turn to. We got options, honey. We got options. So yes, guys, again, I hope these tips were helpful. Please like, share, and comment. Subscribe below. Send this video to a friend, someone who you think will benefit from this. And yeah, I'll see you guys in my next one. Make sure you check out my past videos. I think I have a Q&A on nursing as well that I've done in the past. Maybe I should do an updated one with different questions people might have. But yeah, Lord's will, I'll see y'all on the next one. Shalom.